Hello, everyone. Welcome to the Deeper Life Podcast on the Deeper Life Network. I am your host, Ronaldo Cochran. This podcast brings subjects to surface regarding faith, family, and entrepreneurship. So sit back and relax and enjoy today's show. I'm the son. Today with me, Dr. Paul Hannam. Did I pronounce that correctly?
Yes, sir. Perfect.
Awesome. So, thank you for being here today with us.
It's an honor.
You could have been anywhere else, but I'm glad you were here today. Took out time to be with us today. So thank you very much.
It's an honor to be here. Thank you for the invite.
Yeah, my pleasure. So real quick, for the viewers on Deeper Life Podcast and on social media networks, who is Dr. Paul Hannam?
Wow. Well, I'd say, I guess, number one, I'm a Christian. I believe in God. Number two, I'm a father. I got 3 boys. I'm a husband, of course, to Monique Hannam. That's my wife, and she supports me. But most of my siblings will tell you that I'm a down-to-earth guy. I'm kind of goofy from time to time. I'm the type that'll just kind of do a funky dance from time to time. So, I'm all over the place. I'm also a veteran.
Nice.
As you already know, I'm a physician, so I wear multiple hats depending on what's going on and where I am. So that's the gist. That's my little nutshell.
Yeah. So you mentioned that you're a husband and a father.
Yes.
How many kids do you have again?
I got 3 boys.
3 boys.
Yeah, my oldest is 13, my youngest is 9. And my middle child, he's 12.
Wow, so you got a teenager in the house.
Yes, sir. Yes. and a preteen and a soon-to-be, so yeah.
Yeah, that's it's always interesting dealing with teenagers.
Yes, sir, because they're grown and they know everything.
Yeah, and they're 13 going on 55.
That's right.
Type of thing. So, no, I can, there's exciting times, with a full family like that. Luckily, I only have 1 child.
That's all right.
So I don't have to deal with as much as stress as other parents have to. But yeah, so how long have you been married again?
So this year, I normally talk about the year of the anniversary we're about to celebrate. So we're going on 16 years.
Wow.
So we were married in 2008.
Okay.
And so we're definitely going on in the next year. In October of this year, we'll be going on 16 years of marriage, which is just mind-blowing on multiple levels. So.
Wow, that's awesome. That's 16 years. We're not there yet. My wife and I. We're heading on our 11th year.
But, that's all right. It goes by this fast though. I felt like we just got married yesterday.
Right.
So it's one of those things.
It does feel like that, literally. Literally, it does. Okay. So you're family man, father. You're a professional. You're a doctor. You stay pretty busy.
Yeah, well, I'll be honest with you. If you don't, then you get in trouble.
Yeah, that is true.
And whether that's for whatever reason, the mind. There's a lot going on in the mind. The normal person, the kid, the husband, the father, and so for me, staying busy, keeps me squared away, keeps me focused. Of course, I get more done because I'm actually doing what I'm supposed to do. And I think when you get to my age and your age, you start thinking about things like, okay, what legacy am I going to leave?
Right.
When I'm past and gone, what are my sons going to say about me? Yes. What's my wife going to say about me? My siblings, my people around me, what are they going to say about me? And if you have that mindset, that keeps you pretty busy. It keeps you working on your legacy. It keeps you, of course, you're always providing. It keeps you worshiping God and making sure that there's that aspect of your life that's squared away.
You're right.
And if those things are a priority to you, you have no choice but to be busy. You have no choice but to stay, deliberate and active in the many facets of your life. So,
amen on that. I totally agree with you on that one. speaking of your faith, we're going to get into that here a little bit later on in the interview because I do want you to talk about your faith.
Sure.
Because you're more than just a doctor, husband, and a father.
Right. Right.
So take us back to Portland Cottage, Clarendon, Jamaica.
Clarendon. So you've done
Yeah.
a tremendous amount
Yeah.
of research. I'm very impressed, actually. When I saw that
Yeah.
question, I was like, "Ooh, that's really good." So.
Yeah. So what kind of boy, young man were you? Like,
you know, man, you'd probably have to ask my mom. But here's what I thought of myself. I was all over the place. I loved being out and about, dirt, woods. We this sounds cliche, but we grew up by the sea, you know, and so every opportunity I got, I was in the ocean, in the water, trying to catch these little baby fish, and they didn't want me to catch them, you know, just doing weird stuff that kids who are young and are fascinated with the world would do. So yeah, I was definitely all over the place. Of course, coming from Clarendon, Jamaica, coming from Portland Cottage, we're fairly poor, which is typical for that time. I mean, you're talking about more than 40 years ago, or about 40 years ago. Right. And so for me, you know, I never considered what poor versus rich meant. My environment was rich. My nature, my association with nature was rich. You know, I can deliberately tell you, if I compare where I grew up now and where I grew up 40 years ago, I don't mean to be political or whatever, but there's less diversity in species. There's more pollution. There's, you know, the things that I saw growing up as a child, I don't see them anymore. You know what I'm saying? Yeah. And that's all over the world. I'm sure most people will tell you, you know, if they were intimate with nature, the things that they used to see as children in terms of biodiversity, in terms of God's beauty, you just don't see that anymore. When I go back to Jamaica, my siblings talk about when there used to be dew. Now, if you know what dew is, it's essentially the water that collects on the grass or on the concrete or whatever it is in the mornings.
Right.
And you definitely don't see that as much anymore. Now think about that. Something as innocent as dew. You get up in the morning, you touch the grass, your hand is wet. Why is my hand wet? It didn't rain.
Wow.
That's dew. We don't see that where I grew up now. No, we could say, you know, global warming, whatever we want to call it. I don't want to call it, I don't want to put a label on it. I just want to know that those things that used to fascinate me as a child are no longer there in the same abundance. But even putting that aside, you know, I remember just my family and my mom, you know, calling us every morning and every evening. Okay, it's time for worship. You know, I remember my grandmother just being so attentive to, you know, we had a little bit of sustenance farming, you know, in other words, enough just to keep the family going. She was so attentive to the, you know, we had goats, we had chickens, we had cows. She knew exactly what was going on with every single animal. We had chickens, you know, when they would hatch and lay eggs and the chickens would hatch, she knew what to do to keep them going, keep them alive. And so that's the environment I grew around, you know, the environment where you were intimate with the things around you. You were intimate with the people around you. You know, being able to, you know, you get the love because you weren't rich in things that were, you know, tangible things. You know, you weren't rich in cars and houses and land, but you were rich in love. Right. You were rich in just kind of, I remember as a kid, there was no question about who I was. Because I got that love from my family. I got that love from the people around me. You know, I always knew, you know, because I was always told, you're handsome, you're loved, you're blessed. Whether it was told by words or just by how you were treated, there was no question about whether or not I was loved.
And that kind of probably helped you, you know, during your adolescent age or teenage age,
question.
You know, to get to the peer pressure of
yes,
life and
because that confidence was already there.
Right.
I didn't have to look to my peers to know if I was loved.
Right.
I didn't have to look to, you know, the opposite sex to know if I was loved. I knew exactly what love felt like. And so when I found myself in difficult environment, you know, environments where the average person would question who they are, question whether or not they're capable, it was a matter of whether or not I was capable. It was a matter of, okay, are you practicing enough? Are you studying enough? Are you training enough?
Right.
You know? because the problem wasn't me as a person. The problem was how much effort I was putting in, if that makes sense.
It does.
And so, yeah, I credit my parents. I credit my extended family. I credit, of course, the church. I credit all those institutions around me for making me who I am. And I think that's so important. And that adage that says, it takes a community to raise a child, that couldn't be any more true. As I get older and just kind of retrospectively look, it takes more than just mom, dad, siblings. It takes more than that. And a lot of times we kind of insulate ourselves. Okay, you got mom and dad, that's all you need. And while that's enough, if you want that well-rounded child, having that extended family, the grandparents, the aunts, the uncles, a firm foundation in terms of Christ and the church.
Right.
And everyone kind of saying the same thing and doing the same thing. That's so important. And I don't mean to be philosophical, but you understand.
No, I totally understand.
Yeah.
And I love the fact that you elaborated on that and you broke that down, because people need to, especially the younger generation these days in our community, they really need to know what having true values is all about.
Right.
True family values and doing things the right way. And the old school way, believe it or not, a lot of it
It worked for
works
thousands of years.
It works.
It worked
still
for
works.
thousands of years.
Right.
The audacity that our little thing that we have right now is the best.
Right.
It's one of those things.
Uh-huh.
It's debatable.
I agree.
So yeah.
All right. So, what kind of jobs or professions were you into before you got into the health field that you're in right now?
Right.
So tell me a little bit about your background, because some people think that, you just, you get wonderful grades in school, then you just shoot to, university, go to med school, then you're a doctor, your life is just great. So do you have any type of diverse background in other areas?
A lot more than I'd like to admit to. So as I've said before, I grew up in Jamaica, and I left Jamaica at the age of 17. And at the time, when I moved in with my dad, who was living in Maryland, he said, "Look, we don't have any money to send you to college, so you just have to join the military." And one thing about Jamaican parents, they're just going to tell you how it is. After they tell you, it's up to you. So my dad said, "This is where we are," which once again, understandable. As I said, money was not something that was prominent growing up. So, we didn't have this elaborate conversation about it. I was like, okay, And he said that, I don't know, about a year before, of me finishing my last year in high school. So when I finally moved in with him, we probably said it now and again, but didn't mean anything of it. So one day, at the time I was working at McDonald's. McDonald's, they raised
McDonald's. System and process.
That's right. So I was working at McDonald's, and one day I was sitting at home, I was alone, and this Navy commercial came on. Now, this was one of my favorite Navy commercials. Here's why. Because there's a horn piece by Copeland called "Fanfare of the Common Man."
Mm-hmm.
And I dare not attempt to try the music right now. But you hear it, most people are familiar with it, they just don't know what the name of it. But when you hear it, you're like, "Oh, I've heard that before."
Right.
And it was this aircraft carrier, and there was this guy in his dress whites, and he was doing the whole salute and everything, and the horn piece was just a really good musical piece to add to it. And the number came up, "Call 1-800-GO-NAVY," in that deep voice,
Right.
And I was like, sure, why not? But the truth is, it could have easily been an Army commercial, it could have easily been an Air Force commercial, it could have easily been a Marine Corps commercial. At the time, I didn't even know what the Marine Corps was, And I dialed the number. This recruiter showed up at my door, looking all tall, and he was decent in his uniform. I was like, man, I want to be that.
Right.
Sure enough, a couple paperwork signage later, I was going off to boot camp.
Wow.
It wasn't even a question. Loved every minute of being in the Navy. Loved every minute of it. I was a hospital corpsman in the Navy, which is the Navy's version of a medic. And, boot camp in Great Lakes and hospital corps school in Great Lakes. From there, I was stationed in Okinawa, Japan. It was a hospital. And an 18-year-old boy, guess what they put me at 18,
Where?
not having a clue about life?
Where?
Labor and delivery.
Oh, wow.
And sure enough, being in labor and delivery, learned a lot about the female body. Some would argue more than I wanted to learn. But I also had just this newfound appreciation for life and what women had to go through to bring life into this world. And there's that professional aspect of it, but then there's the military aspect of it. Your uniform got to be squared away, go to places on time, make sure you kind of knew all that you needed to know. So I really took that seriously. But for me, it was easy, and here's why it was easy. If you're my chief, I come to work in the morning, Hannam, do this, this, and this. Okay, chief. Okay, sir. Okay, lieutenant. Okay, captain. Whatever rank it was. Right. And boom, do it. And then I go home and I do it again. I didn't have to think about it too much. That's why it was easy. But as I got older, I had to put more thought into the things that I did, where I went, how I spoke. And so from Okinawa, I went to Field Medical Corps School, which is how they teach you to actually be a field medical corpsman. And then from Corps School, I was stationed with the Marine Corps in Cherry Point, North Carolina. And being stationed there, got deployed to Iraq and came back. And I was getting close to the end of my first enlistment. And at the time, you're really kind of having to grapple with, okay, do I want to get out? Do I want to stay in the Navy and be a lifer? 20 years. Right. And I went home on leave one day, and my stepmom looked at me and she said, "Do you want to go to college?" I was like, "Yeah, let's do it." and it was that simple question that it's a simple question. Right. How many high school students get asked that question every day? But for me, that was like the difference between in a room where there's no doors to like all of a sudden this door just appeared out of nowhere.
It just opened up.
It just opened up.
And then you knew your
I knew exactly what I wanted to do.
Direction.
I was like, why am I staying in the Navy? And giving my youth, my energy, my efforts to the man.
Right.
When I can actually do something for myself. And so my stepmom asked me that, and then she gave me this college application. At the time, it was to apply to Wilberforce University. And at the time, being from Jamaica, I didn't know what a HBCU was. Because in Jamaica, every school is a HBCU. You know what I'm saying? Most of the population is black.
Right.
So coming here, and Wilberforce is an HBCU, and it's named after Wilberforce, which is a British person, I think from the House of Commons, who was instrumental in ending slavery in the British Empire.
Oh, wow.
Yes. And so at the time I applied, I was applying to Wilberforce, but then went back to my duty station in Cherry Point, North Carolina, and I went with a friend to visit her sister's college, and that was High Point University. And so doing my application to Wilberforce, and I was like, why not apply to two colleges? So I applied to High Point University. And at the time, High Point University was like, I applied, boom, replied back. I applied, boom, replied back. So they were giving me that positive feedback that I was looking for compared to Wilberforce University, where it was taking some time to get the exchange that I wanted. So by the time I heard from Wilberforce, hey, you're accepted, I'd already gotten an acceptance from High Point University. And I'd already responded, okay, I'm going to go. And so by the time I got something from Wilberforce, I'd already accepted High Point University, just from a time frame perspective.
Right.
So that's how I ended up at High Point University in High Point, North Carolina, compared to Wilberforce University, which I want to say it's in Ohio.
Wow.
Or, don't quote me, but it's a Midwestern state.
Midwestern, okay.
Yeah.
So, okay. So you did the military.
Yes.
You went to school.
Yes.
What would you say inspired you to get into the health field? Like what? I guess, gave you that unction that this is what I want to do?
You bet. You bet. So as a youngster, this is so weird, I had a list of professions that I wanted to be. So amongst those, pilot, military, doctor. I think there was one other one that I can't think of at the time, but I had a top 4 almost, and so as I got older, and being a hospital corpsman, which is a medic, it exposed me to the medical field. So I was able to see what doctors do.
Right.
I was able to see what nurses do. I was able to see, what we'll call paraprofessionals. That's your paramedics, your EMTs. You also have, physical therapists and pharmacists. So I was able to get in the vicinity of a lot of those professionals that were intimately involved in the healthcare field. And so by the time I was finished with High Point University, being a biology major, I knew that medicine was it for me. And it's amazing how, somebody can be planted at the right time of your life. Because as a youngster, you think you know so much.
You could have did anything.
It could have, right, and that's exactly what I'm saying.
Yeah.
The people that were planted in it's kind of like my stepmom saying, are you going to college? It was that pivotal moment for me. So being at High Point University, a professor that I look up to, she was a biology professor, she was just awesome at what she did. She's like, Hannam, what are you going to do? Or Paul, what are you going to do?
Right.
It's like, well, I want to go to medical school. But I didn't have a clue. And at the time, Google wasn't as prominent. And the internet, it was a good source of knowledge, but it wasn't as easy to get to things as it is now.
Right.
And she said, okay, here's what you need to do. And she just laid it all out step by step. You need to do this, you need to take this test, you need to apply on this application process, you need to do this. Once again, another pivotal moment, because once she laid it all out, there was no further barriers to becoming a physician. And so for me, the application process, but prior to that, while I was still in the Navy, and while I was deployed to Iraq, we kind of went on this kind of friendship mission to talk to some of the locals that were in and around the area where we were stationed at the time in Iraq.
Okay.
And at the time, when we went, they were there, a lot of the kids were there for the American candy and, the American stuff that we had to bring. But what I also noticed is we were giving out a lot of medicines. Things that we take for granted, Tylenol, ibuprofen, all these things that we take for granted here in the United States.
Right.
We were handing those out, and those were treasures for some of these locals in Iraq.
Wow.
And that was my, eureka moment, my epiphany. You want to be a doctor. For me, that was it. I wanted to be a doctor. There was nothing that was going to change my mind from that moment on versus coming out of the Navy, going into college, majoring in biology, applying to med school. But I didn't get into med school right then and there.
Really?
I did not get straight into med school.
So did you have to, I guess, reapply a few times before
Yes,
you got accepted?
I'm glad you brought that up. Yes. So graduated 2008, and I didn't get it. Well, let me take that back. So I got into a med school in the Caribbean, but I didn't get into a med school here in the United States. So I was like, okay, let's try again.
Right.
But at the time, I proposed to my wife on graduation day, so whether or not the wedding was going to happen.
Right.
So I needed a job, So I was like, I'm a science major, which was biology. What's the quickest job you can get into that's almost guaranteed, And that was teaching. As a biology major, you have enough chemistry to teach chemistry in high school.
Right.
You have enough biology to teach biology in high school. You have enough physics to teach physics in high school. I had enough of almost all the sciences to teach almost any science course in high school.
Interesting.
Yeah, so I became a high school teacher.
So how long did you do that?
I taught high school for 2 years. 2
years, and you said after 2 years,
I knew exactly that I did not
need some
want to
more
be a
money.
teacher.
Was it a finance reason why you stopped after 2 years, or was it, you wanted to get into your true purpose, true calling?
Well, I knew that I did not want to teach high school. So that was definitely part of it. Nothing against teachers. I think teachers do a really good job. I think we owe teachers a lot in this country. I just realized that teaching high school was not for me.
Right.
That's number one. Number two, the whole time I was applying to med school. The whole time I was applying to med school, it's a 1-year application process.
Yeah.
So it's not like you can, it's multiple applications in 1 year. So in other words, it took me 2 cycles, as a matter of fact, 3 cycles to get into med school. So it was that year I graduated, it was the first year of teaching, second year of teaching, and then I did another year when I was recalled to the reserves, and it took me those 3 years before I got into the med school that I wanted to get into.
Wow. Exciting.
Thank you, sir.
Yeah, it goes to show you that, especially for the young people out there, that just because it doesn't happen the first time, don't give up, keep trying.
There you go.
Because it might not happen right now, but it might happen 6 months, a year, 2 years down the line.
And that's absolutely true. I think a lot of times when you're that age, you also don't appreciate the numbers that you're up against. There are hundreds of thousands of students that apply to med school that has a slot of about, I don't know, maybe 40 or 50,000 people.
Wow.
And think about that for a second. So, and remember that if you have the nerve to apply to med school, you're saying that you're the cream of the crop.
Right.
But more importantly, you're going up against the cream of the cream of the crop. And so a lot of times we don't appreciate those numbers. We don't appreciate the odds.
Right.
We don't appreciate that. Look, there are this many slots, and for each slot, there's 10 applicants for each slot.
Right.
And I don't mean that in despair, but I mean to share it to say that if you're serious about it, don't just take the first no or the second no.
Right.
Go for it. Push forward. Try multiple times. And for me, I tried multiple times. And I got a couple different interviews, and one of them was Meharry Medical College, which I don't know if you're familiar with, is also an HBCU.
Nice.
So,
I like that.
for me, I escaped Wilberforce, but I didn't escape Meharry. And we can do this offline or online, but I'd love to talk more about, just going to an HBCU and what that means to, someone like myself who is an immigrant, and I think it really opens up my eyes to a lot about just American history and what it means for people of African descent in this country. And I think I learned a lot more than I originally expected to learn.
Wow.
So love it. Loved every minute of it.
Wow. Well, that gives me something to look forward to, because like you said, whether it's online or offline, we're going to definitely talk about that. 'Cause I'm pretty sure we can pass that information on to some people in our community.
Sure, you bet.
So okay, so in your opinion, how are blacks and minority patients portrayed in the health system in 2024?
Sure. Let me just say that things are getting better.
Okay.
And when I say that, I mean if you compare now with 30 years ago, 50 years ago, 70 years ago, that's not what I mean by it. So it's getting better. However, the stigmas are still there. It's these what we call intrinsic biases, the ones that are there that we don't know about, but they rear their ugly head when we're on autopilot.
Okay.
It's kind of like, when you see, someone in a hoodie run up to a lady, your first instinct is, OMG, they're trying to rob or cause harm.
Right.
When maybe he's just returning her phone that that fell from her, or maybe it's her husband and he's just kind of running to say I love you. It's those implicit biases. And the truth is, everyone has them.
Yeah.
Whether you're a physician of color, or a Caucasian or Asian, it doesn't matter.
Right.
You have it. You have it because we're susceptible to the same media. We're susceptible to the same schools. We're susceptible to the same kind of social psyche. And because we're all susceptible to that same ideas that permeates your society, it also means we're all susceptible to the same burdens and almost biases that social psyche kind of puts on us. And so, I started to catch myself. Let me explain a little bit. So I was in residency, and I recall, feeling different about my black patients than I do about, the average patient.
Okay.
And so one day I really had to check myself. I was like, well, why is it you feel this way about this patient? Why is it you feel this way about these patients? And it really opened up my eyes to realize that I was pushing these narratives that I had in my head about the average black patient on my patients, even though I didn't know their background and I didn't know where they were coming from. So that was the first thing that I was able to kind of look on from an introspective standpoint. The other thing is when these patients show up, they're already having a bad day.
Right.
When's the last time you went to the doctor because you were feeling good?
Good point.
Right? So when these patients show up, they're already having a bad day. The last thing they need is a physician who's going to put them in a box. The last thing they need is a healthcare provider who's going to already determine who they are and what's going on with them when you haven't even spoken to them for more than 2 minutes. And so I found that I really had to step back and rethink how I was boxing my patients in even before I spoke to them.
Wow.
And if I'm a person of color, and if I grow up with people of color all the time, my family are people of color, so I had to ask myself, well, what does that mean for the other physicians who are not people of color? And it doesn't mean that they don't think about this. A lot of them do. Right. But it takes time. And a lot of times these patients are going to have multiple episodes of dealing with these biases in healthcare before that physician goes through that process of doing a rain check. And so a lot of it needs to be taught, even from the medical school, of, be careful how you look at your patients. Be careful what biases you put on them before you even know who they are. And so I started making a conscious effort to treat every patient as if they were having a bad day. And so I said to myself, how can I make this day better for my patient? Yeah. They're already sick. They're already having an ailment. They're already having this issue from the drug. They're already having this issue from the antibiotic. They're already having this issue from whatever another doctor has caused. How can I make their day better? And so a lot of minority patients go through this because, they're poor, they shouldn't be getting the latest and greatest drug because they can't afford it. They're not going to do the lifestyle changes that you recommend anyway, so why recommend it? Why not just put them on the drug and send them home? Right. Then there's a whole idea, well, did you talk to them about the drug they're taking? Did you? And that's and the other part of medicine is, we've always categorized people of African descent differently. We've always given them different medicines. Now, we could argue, bad or good, and one example is, and you can find this on TikTok if you ever decide to look it up, but one example is how you calculate kidney injury. When you calculate the kidney, or what we call the GFR, glomerular filtration rate, when we calculate it in a person of European descent, there's one calculation, but when we do it in a person of African descent, predominantly sub-Saharan African descent, there's this other calculation that affords for their kidney to be more injured. I don't know if that makes sense. Wow. And what that ended up doing in the long run is it disqualified people of African descent for kidney transplant when they needed the kidney transplant.
When they probably needed it the most, probably.
Well, essentially saying that their kidney, even though it's showing, symptoms of damage, is not as damaged. And so what ends up happening is people of African descent did not get as many kidney transplants. People of African descent did not get the care they deserved because of these kind of weird tweaks to different formulas that essentially put people of African descent at a disadvantage. And we could call it deliberate, we can call it skew, we can call it whatever we want. I'm not calling it that. I'm just saying these are some of the things we've done traditionally in this country. But we're finding a trend against that nowadays. So the glomerular filtration rate is now no longer different for people of African descent versus people of European descent. It's now just one calculation. And we're also finding that now people of African descent who otherwise did not get kidneys are now getting their kidneys for kidney transplant. As a matter of fact, I have a friend whose aunt, she just got a letter from one of the major hospitals here in St. Louis apologizing for this shortcoming. And after they changed how they calculate everything, within a week or so, I think within a week or a month, she was able to get her kidney for her kidney transplant.
Wow.
And so it's having real effect even now as we speak. So yeah, there's a lot of shortcomings, but we're doing better. We're getting better.
So the health community, what you're saying, what I hear you are saying is that the health community they are growing, they are moving in the right direction.
Yes, sir.
To treat everybody on the same playing field, so to speak.
Yes.
And that's it's funny because you would think that's how it should have already been. That everyone should, but as we know in this country, money and does play a huge role. If you're in this income bracket, obviously you're going to be treated the best, the top of the line, the best physicians. I mean, you're going to have the best of everything. And then if you're in this lower income bracket, obviously you're probably going to have to struggle to get what you actually need medically.
And that's the next major barrier to cross is this socioeconomic status where America is almost like we have a class system. We have the poor, lower class, and we have the wealthy, upper class, and the only thing that allows people to transition between those classes is education. And what are politicians going to cut the fastest when they need to cut the budget? What do they cut?
Oh yeah,
Education.
From the top all the way down to all the way down to the little elementary school kids.
Right. Just cut it all.
Or just suffering, going to elementary school, just suffering. Poor kids, I tell you.
Oh my.
But yeah, you're right. That's the first thing they cut. But I'm happy to know that it is headed in the right direction. So I'm definitely happy to know about that. All right. So on to my next question, which I feel is a very good question for your sake, is why did you start Hannam House of Health? You're the owner.
Yes.
So you run the show. You make the decisions. So why did you step out on your own versus working for a big name hospital or national hospital?
Sure. Let me just say this. There's nothing wrong with, the larger healthcare institutions. They have their issues, and I don't want to get into it because we could talk about it all day.
Yeah.
But I was looking for something different in healthcare. When I work for a larger healthcare institution, what it means is that they get to tell me how to treat my patients. They get to tell me, when to be at work, when I can go on leave. And then most importantly, I am at the behest of the insurance companies, which, depending on your specialty, may not be a bad or necessarily a bad thing. However, I started House of Health because I wanted to treat my patients the way they deserve to be treated. And I didn't want to have to only do what the insurance companies would pay for. You see, currently, if my patient comes in and I suspect a torn ligament or a torn tendon, I have to go through this dance with the insurance company before I can order an MRI. Well, if the ligament's torn or the tendon's torn, the imaging of choice is an MRI. Sure, I could do a CT scan, but the imaging of choice that's going to give me the best image is an MRI. But because I have to do this dance with the insurance company, I have to do 6 to 12 weeks of conservative measures, which is like ibuprofen and rest and blah, blah, blah. You don't have time to be out of work for 6 to 12 weeks. You don't have time for that.
Right.
You're losing money. So as your physician, part of my job is to get you back to the best place I can get you so you can get back to work, so you can provide for your family. But if I'm listening to insurance companies, then I'm going to have you in pain or try these conservative measures for however long so you can come back and tell me, Doc, that's not working.
Right.
In the meantime, you're paying your insurance premiums. You're paying your $600 to $1,200 a month to the insurance companies so they can turn around and tell me they're not going to pay for an MRI right now, but once those 6 to 12 weeks are up, they'll pay for it, even though I already know that you need an MRI. And that's one example of how insurance companies give physicians and their patients the runaround. And the problem is, if I'm the physician and the insurance companies are the one that pays me, do you think I'm going to be listening to you or am I listening to them? It's unfortunate, but what it boils down to is because he's the one that pays me, he's my boss. Now, let's flip that around. Let's get this guy out the middle.
Right.
And let's make you the boss, since you're the patient.
Right.
Let's make you the one that pays me, so now you're the boss. And when you come and you say, Doc, I think I sprained an ankle. I look, it's all swollen. I suspect a torn ligament, a torn tendon. Hey, how about we do an MRI? Now, if you're willing to pay for your MRI out of pocket, I'm sending you straight to that imaging center. I don't need to beat around the bush, especially if I suspect MRI is going to give me everything that an X-ray or a CT scan will give me and more.
Okay.
And so, understanding that when you're the boss between you and your physician, if for one reason or another, you don't think that I'm giving you the care that you deserve, you can now decide to sever this relationship and establish another relationship. But if your insurance company says, okay, sorry, that's the doctor you can go to, that's the doctor we'll pay, we won't pay any other doctor, you're going to have to pay out of pocket. Now, not only is the insurance company that you're paying of less value to you, the physician that you've been talking to this whole time who knows your history, you have to find a new one. And you may not be able to find a new one because he's telling you that that's the doctor you have to go to, even though that doctor's not listening to you, is not listening to what you have to say.
Right.
So you can see how frustrating this can be. So I've decided that I want to sever this relationship between the doctor and the insurance company, and my relationship should just be between me and my patient. And what you end up finding is there's better patient satisfaction. The physician work-life balance is also better, right? I spend more time with my patients instead of you waiting for 2 hours and seeing me for 5 minutes, right? Not just that, because the patient is my boss, right? I'm treating that patient with the dignity they deserve. And you can text me, call me, email me anytime outside of working hours. So now you don't have to go to an urgent care to see a doctor that doesn't know you, doesn't know your history, because you're going to see the doctor that knows your history and knows what's going on with you and knows exactly how to treat you.
That's amazing because when I think about and I'm fairly decent health person, but the times that I have, throughout my lifetime, went to the doctor, man, I mean, you're waiting. I mean, whether it's an urgent care, whether it's an ER, I mean, you're literally just waiting for a long time
Right.
to see a physician, and you'll have once they do call your name and you go in the back to the waiting room, a nurse come in, admin person to come in, they're getting your information, you're just sitting, you're still waiting. So
Right.
so I do understand that what you have created, it seemed like it works 100% better than just the normal process, because patients could just come in, they have most likely, even though you do take walk-ins,
Yes.
you do take walk-ins, but they could come in and they can see you, and there's no long 2 or 3 hour waiting period, which is
Right.
great. If you ask me as the consumer, or the patient, so to speak, but yeah, that's really powerful that you decided to go that direction. Now, did it hurt you financially to go this direction?
Well, yes, in the sense that when you go with a larger healthcare system, they already have the patient base, so you start getting paid day one. With opening your own clinic, you have to build that clientele, especially what I call the direct primary care practice model. You have to build that clientele, and so for me, my first month, I may have one patient.
Right. Right.
The second month I probably had 10. And so what ends up happening is you have to be ready to kind of dig into your savings and dig into or maybe do side jobs in order to kind of stay afloat until the clinic is self-sufficient.
Right.
And so yeah, but it's a short-term suffering
For a
for
long
a long-term gain.
Long-term gain.
Yes.
Okay.
And I think I'm at the place now where the clinic is starting to pay for itself, and the hope is we get to a place where it's paying for itself and it's paying me.
Right.
And maybe even I can hire a couple more staff members and
Right.
and be a benefit to the community in that way. But things are looking up, and thank God, I'm not complaining.
Well, I look at you and I see you're no different from any entrepreneur out there. I mean, you literally, when you're in entrepreneurship, you literally have to fund your own dreams, fund your own ideals,
Yes,
everything's
sir.
out of your pocket,
Yes,
and
sir.
then you're not getting paid initially in the beginning, but your hope is down the line to have future gain, future lifestyle, freedom,
Yes.
everything that you look at, fulfillment,
And that's a big
Yeah.
part of it too, is freedom. Yes, owning your own business means more responsibility. It means there's nobody else to pay the additional 50% of your Medicare
Right.
input. I don't know if
Right.
I don't know if you know what that means, but every time you work for somebody, you put half in and they put
the
half
other
in.
half.
But when
Yeah.
you work for yourself,
You gotta put the whole thing.
you gotta put the whole shebang in. And so,
Oh, did I find that out?
I know that's right. And so, yeah, there are more responsibilities, a little bit more taxation. However, the freedom that I get knowing that, look, if something's gone sideways, I can close the clinic today and go take care of something at home.
Right.
And I don't have to explain this to a boss. I don't have to explain this to, some random guy who doesn't care. And that's one of the big beauties of owning my own business, owning my own clinic. The other thing that I really appreciate is when my patients come in, they see me. I'm also the one that's taking care of him. They also text me, and they know if they text, they're getting me. And a lot of times when patients just come in and be like, gosh, doc, thank you so much. I did blah, blah, blah. I couldn't get in to see my pediatrician or this other doctor, but you were able to get me in, thank you.
Right.
And so I also realize that I'm providing a benefit to the people that I serve. More so than I even anticipated, to be honest with you. And the direct primary care model it's about 15 to 20 years old, but it's growing because a lot of physicians are tired of the status quo.
Right.
They're tired of the insurance company telling them what to do. They're tired of hospital business administrators telling them what to do when it comes to their patients.
Right.
They want to be able to treat their patients with the care and the dignity and the time that their patients deserve. And so a lot more physicians are wising up to this idea of, a lot of people use the term concierge medicine. I don't use that term because it gives off this idea of, oh, that's for rich people.
Right.
I don't want to give off that idea. I want anybody to come to my clinic and feel like this is for them. And so I try to keep my pricing as such. I try to keep my access as such. I try to keep it so that anybody can come to my clinic and feel like, yes, I can afford this, and I don't feel like I'm breaking the bank, and I feel like my doctor's paying attention to me and they're treating me the best way that's possible. Now, caveat, of course, I don't see my patients in the hospital, so if they get hospitalized,
Right.
they are at the mercy of, those larger institutions.
Right.
Of course, I'm not an insurance company, which means, if they come in like a larger car accident or a stroke or cancer, that's not something I can treat.
Right.
Because that requires specialty care. And so while I can't do 100% of care, I can do most of what the average typical primary care provider or even pediatrician could accomplish in their patients on a day-to-day basis.
So speaking of that, this next question kind of leads into what separates you from other clinics, other, I would say small practices, so
Sure.
to speak, is your monthly membership plan.
Yes.
So tell us about this monthly membership plan that you offer at your direct primary care clinic.
Sure. So because because I don't take insurance, the way that my patients compensate me is they pay a monthly fee. And that monthly fee covers however many visits, they want for that month. Including phone calls, text, emails. And what that means is access. Now, how old is your child, if you don't mind me asking? You don't have to answer.
He's 6.
Okay, great, perfect age. When your kid gets a fever, he's sick.
Right.
The first person you're probably gonna call, apart from your wife, is the pediatrician.
Right.
Hey doc, little Johnny, I don't know if that's his name, but little Johnny is sick. He has a fever, he's had a fever for 2 days, he's not eating, he's hardly sleeping, whatever the case may be. And I don't know if you've ever heard this, but we're full, we don't have any openings for the next week or 2 week or
Yes, I have.
5
Many
days.
times.
And that can be frustrating. So then you're having to revert to going to the nearest urgent care.
Right.
Where you may have to wait for 30 minutes or 3 hours.
Right.
It's hard to say depending on the rush. Well, being in a membership like mine, you shoot me a text or give me a call. Hey doc, little Johnny has a fever of 102. What do you think? Well, I have an opening at 11. I have an opening in 30 minutes. Can you get here in 30 minutes? If not, okay, I have an opening at 11. Can you get here by 11? Or even, if for one reason or another you can't come see me, I have a program where you pay a little bit extra and I come to your house and look at you.
Wow.
So in this case, you bring Johnny in. I kind of look over, see what's going on, see, okay, is it a ear infection? Is he getting the cold, the flu, or is it something else?
Right.
And once I make my assessment, most times I'm probably going to have the medicine in my clinic that he needs. If I don't, I'll send it to the pharmacy. But if I do, you get it right there. You would have saved 30 minutes of going to the pharmacy to pick up that medicine.
Wow.
And so, so the convenience, especially for parents with young children, is second to none, because they don't have to miss as much work. They can just bring Johnny in, get taken care of. Johnny feels better, they go back to work. Or Johnny feels better and he goes back to school. And so you cut down on that anticipatory time. You cut down on that time when you're like just going crazy because your kid's sick and you can't get in to see the doctor. So a lot of it is peace of mind. A lot of it is access. And a lot of it is just having a doctor that you see the same person every time.
Right.
Who knows you and knows what's going on with your life. And you can text him anytime. You can email him anytime. And if it's even that urgent, you can even call him. And I think for a lot of people, that just means so much. And so what they're really paying for on that monthly basis is the peace of mind and the access. And they don't pay anything extra when they come in. So if you come in to see me 5 times in the same month, unless I'm giving you medicine or I'm drawing labs, you're not paying anything extra. Because you've already paid me that monthly fee.
Yeah, it's interesting. When I was stalking your website to to find out a little bit more about you, and I ran across that, and I was just amazed with the fact that, you know, just like Netflix, you could pay a monthly membership for your health care. Some people obviously pay a monthly fee for their or a bi-weekly fee because of their job or whatever.
Sure.
But what I like about your services and this monthly plan that is economical. Anyone can afford this, no matter
Right.
if you're working at McDonald's or if you're a CEO of a company or VP
Right.
of a company. Anyone can afford this, and I just it's just amazing. It's just
Thank you. I
amazing.
appreciate
So.
that. Yeah.
So I would definitely be signing up. So and for the viewers and listeners, they can easily go to your website to sign up for that membership plan,
Yes, they
right?
can. Yes.
And before we get into this next question, what is that website again?
So my website is myhouseofhealth.net.
.net. Okay.
Yes.
Okay.
And
good.
if they click on the membership tab, it breaks down cost, pricing, and all their benefits. And they're able to click on that register tab if they think this is what's best for them. I also do free consultations because a lot of people are not used to this. They
Right.
think it's a gaffe, or maybe I'm a quack, or maybe I'm not a real doctor. And so I offer a free consultation. They can come in, they can see all my credentials, my license, my degree. I have all that stuff in my office, and more importantly, we can talk about how I can best serve them. There are times when a patient is sick enough that I don't think I'm the best person for them.
Right.
And while that doesn't happen often, when that is the case, I say, I don't think I'm the best person for you. But overwhelmingly, most patients, I can be of service for them. Yeah.
And it looks like also that not only do you cover individual plan, family plan, but
Yes.
there is an employer plan
Yes,
also
sir.
for
Yes.
people that are small businesses.
Yes.
So
Because as small business
yeah.
folks, we got to help each other.
yeah, we got to help each other out. So if you guys are small business, you're a small business owner, get your family in this plan. I say
This is the way I think about it. If you're a small business owner, you're probably losing employees to some of the larger firms who can provide a healthcare benefit.
right.
But you can't afford the $5 to $10 grand a month to cover all your employees for them and their family's health insurance.
Right.
Well, this is a best middle ground. You say, okay, I may not be able to cover hospitals or car accidents or some of these major medical costs, but I can provide a primary care provider for you.
Nice.
And so if you're an employer, you automatically get a 20% discount on your employees. You have to enroll at least 2 employees.
Nice.
And once you enroll your employees, they get all the benefits of a full paying member,
Wow.
right? Except you're the one that's paying for that benefit. And for a lot of employees, that's the difference between keeping a good employee
Yeah.
and losing a good employee. Because if you have Fred, who's 54, he has high blood pressure, he's probably gonna, but he's a good worker, and he's like the history of your company.
Right.
You don't want to lose Fred to another company down the road who is just going to treat him like a number, but give him health insurance. You want to keep Fred.
Right.
And how do you keep Fred? Well, let's get him a doctor who's going to help him with his high blood pressure, help him avoid a heart attack, keep him from being diabetic, and that's where someone like myself comes in.
Mm.
So I do think it's a good benefit for a lot of employers who want to have that edge up, but just can't afford those larger employee health plans.
Yeah, I agree. Well said. All right. So tell us about your faith. We know, I know that you are a believer. You're a Christian man, Christian family, and you attend church quite frequently.
Yes.
So tell us a little bit about your faith and how that plays into your clinic.
Yeah, thank you. So, as you may know, a lot of folks, especially from the conservative community, the movement nowadays sometimes tend to be, avoid vaccines, avoid some of the more, what we call the more traditional ways of medicine. And while I'm not an advocate of avoiding vaccines, I find that when you're in a clinic, an independent owner of a clinic, then you can facilitate some of these patients a little bit more. Because the truth is, they still need healthcare. They still need a physician, especially when it's an urgent matter. And I want to be that one that they can call. That's not going to force them to get a vaccine. But most times, I'm going to say, look, I think you need this vaccine. Yeah. But there are times when we just agree to disagree, and we still have a good patient-doctor relationship. And so that's one aspect of how I'm able to kind of incorporate a lot more of these kind of more conservative members in my clinic. But more importantly, it's really hard to be a Christian and not be an advocate for people. Right. It's hard. If you're a true Christian, it's hard to not be an advocate for people. And if you're a true Christian, it's hard to not be an advocate for people who are less fortunate. Right. Now, and I'm gonna let that sink in a little bit. When the rich ruler came to Jesus and said, "What's the greatest commandment?" He asked Jesus, "What's the greatest commandment?" As in, what is the greatest commandment? A singular. He asked him for a singular greatest commandment, and Jesus gave him two commandments. He said, "Love the Lord your God," and he said, "And the second is like unto it, love your neighbor as yourself." Mm. Now, Jesus could have easily stopped at love the Lord your God with all your heart, but he didn't stop there. Right. So it tells me that as a believer, to live a full life that's pleasing unto God, it's hard if you're going to say, "Oh, I love God," but then you turn around and dismiss your neighbor. Right. And there's not many truer callings that forces you to interact with your neighbor than that of being a physician or just your typical healthcare provider. Right. And so, and I have patients, and don't tell this to my wife, but I have patients that come to my clinic, and then they may not be able to pay right then and there. Right. But for one reason or another, I think they're good for it, or for one reason or another, I think there's something we can work out, right. And I'd rather work that out. There's a gentleman that comes, he can't pay financially, but he cuts my lawn, and I'm okay with that. Wow. I'm okay with that. Now, I can't offer that to everyone. Right. But you know what? He does a really good job at cutting my lawn. So I have no problems with having him cut my lawn, and I provide services. And I'm fine with that. And I think part of being a Christian, I think, is God's calling us to that flexibility. You know, don't be so rigid in how you care for others. So I think that's another way that my faith really informs how I treat people around me. And I'll be honest with you. It's really hard to try to do this and not have just an overarching ability to empathize and sympathize with the people you're around. And a lot of times in the Bible talks about Jesus having compassion on people. Yeah. A lot of times we never really understand what that word compassion means. It's having this overwhelming feeling of empathy for somebody else. It's feeling what they're feeling. It's understanding what they're going through. Right. And you really have to be in that moment when somebody walks in your clinic upset, and you really take that kind of negative energy and turn around and be like, "I'm sorry you're having a bad day. How can I help you? How can I make your day this much better?" Right. And that takes a because if you come at me angry, it's easy for me now to want to defend myself, right? Right. But it takes a different level of understanding to not only put down my guard, but in doing so, I put down your guard as well.
I like that. That's powerful. That's true, because it's like putting yourself in someone else's shoes,
isn't it?
To understand fully what they are going through.
That's right.
And that's powerful. And I'm glad that your faith, you know, coincides with, you know, your services and it's almost like a ministry. You know, your health clinic is, you know, you can come get a checkup, but man, you're providing a service, you're providing a ministry because you're blessing these people and you're helping them to prolong their lives, you know, physically and hopefully one day if they're not spiritual, they'll get spiritual. You
Right.
know what I mean? You know, so you know, man, this has been a pleasure to sit down with you, Dr. Paul Hannam. I tell you, you are inspiration to me and hopefully everyone else that's listening and viewing this on social media channels and things. But how can people get a hold of you? I know they can go to your website, but do you have any social media handles or anything you want to kind of like point people to or anything like that?
I am crappy at social media, but if you want to subject your eyes to such, you can find me on Facebook. So I do have a Facebook page for my clinic. It's called Hannam House of Health on Facebook. If you don't put in the Hannam, you won't find it. There's a million House of Healths on Facebook, but there's only one Hannam House of Health.
That's right.
There's on TikTok. You may also find me on TikTok. You can either search Hannam House of Health on TikTok, or you can search Dr. 2 and Go Box. So Dr. to Go Box is kind of what it turns out to be. So Dr. 2 GOBOX. Either of those will get you to my TikTok page. Essentially, I talk about some healthcare issues and different ways to treat or prevent diseases. But once again, you do it at your own peril.
Right. Well, I tell you, man, it has been a pleasure. And
thank you so much. It's definitely an honor to be here, an honor to talk to your audience, and just for you giving me that space. That means a lot to me, and I thank you so much.
Yeah, and tell your wife we're getting her next.
You bet.
Get her on the show next.
Now, she's a little more slippery than I am, so good luck.
Right, I know. So, well, doctor, it's a pleasure, sir.
Same here.
Thank you. And for those of you that are viewing us on Facebook or YouTube or listening to the podcast, thank you guys for joining the Deeper Life podcast on the Deeper Life Network. And stay tuned because we have a lot more powerful leaders coming up on future interviews. As you guys know, this podcast is about faith, family, and entrepreneurship. So again, it's a pleasure, and I'll see you guys next time.
Thank you for listening to today's episode on the Deeper Life podcast. If you enjoyed listening, please like and share this episode to continue hearing inspiring episodes as this one.